Welcome to Generous Impact. This is Bret Brummitt.
And this is Amanda Brummitt. We are joined today by Matt Vestal of Junction Health. In this episode, you'll hear how the team is actually improving healthcare. Yep, I said it, actually improving healthcare. They put infusion centers in federally qualified health centers to bring life-promoting infusions to people that often wouldn't be able to access them in a traditional infusion model because of financial barriers. Well, Matt, thank you so much for joining us today. I would love it if you could start by just telling us who you are. What's your background personally and professionally?
Yeah. Well, thank you, first of all, for having me on, Amanda. I know that apparently Junction Health is only the second Brummitt Group client to be on the show. So
that is right.
It's a real privilege. As I mentioned, I'm here representing Junction Health. I'm one of three co-founders. It's myself, Matt Vestal, and then I've got two partners, Ben Wiederholt and Vinny Polito. My background is, professionally, I've always been in healthcare. Got my master's in healthcare administration back in, 2009 I graduated. And then, around that time, it was an interesting market because Affordable Care Act had just been signed. The High Tech Act was signed that pumped, many billions of dollars into the electronic health record industry. And, I was from Kansas City, so I always knew about this little EHR company called Cerner. And that's where I started my career, which actually turned out to be amazing because it allowed me to learn and understand technology for better and worse, right? I think there's significant opportunities to improve the EHR in general, but it was a really wonderful experience and jumping off point. And then, after 4 or 5 years at Cerner, jumped over into more strategy consulting, worked with a company called SG2, which is now a subsidiary of a large group purchasing organization called Vizient. But
little company.
Small company, yeah. You might have heard of them. But it was great. I mean, it was a really wonderful opportunity early in my career to see, what was going on in the boardrooms of a lot of hospitals and health systems, what the executive teams were talking about, what the concerns were. Gave me an incredible opportunity to see a group of folks that were genuinely passionate about serving the needs of their communities, but doing so in a world with all kinds of misaligned incentives and backwards in financial structures. And so I kind of decided I wanted to transition away from that so that I could do some different, potentially more innovative things, and kind of got bit by the startup bug. And so really the past, almost 10 years have been spent, trying to work with companies that are either technology or tech-enabled services companies, sometimes venture-backed, private equity-backed, to help lay the foundation to grow a meaningful business that is thinking about delivering care in an innovative way and isn't beholden to some of those traditional fee-for-service constraints that really do plague a lot of traditional provider organizations in the market. And here I am today, now with Junction Health. We founded the company about almost 2 years ago now. We are venture backed, and last year, at the beginning of the year, is really when we started to hit our stride. In May, we closed our first deal with the state of Florida's largest federally qualified health center. We went live with our first infusion center in the Tampa market in September, which, by the way, Bret and Amanda, terrible idea on the west coast of Florida to try and go live in September, October, November, because within 10 days of opening our center, we were hit with 2 hurricanes, which disrupted some operations. But we've recovered, I'm happy to say, and we're actually looking at significant regional and statewide growth and expansion in and around Florida. We just signed another client over in the St. Petersburg market, just to the west of Tampa, and then we're looking, in many more different markets and other states to expand and grow pretty rapidly. So we're thrilled at the way the trajectory of the business is going and the impact that we're going to have on not just the federally qualified health centers, but by extension, the communities and patients they serve.
Nice. Awesome. Okay. Going back on your background, 2 questions.
Oh, I have one too.
Okay, you go first.
Who graduated first with their MHA, you or Matt?
Well, can I answer that for you, Matt? I thought we were roughly the same age. We've been working together, almost a year now?
We're not?
And no, I've got like a decade on you, and it was a little hard for my
Wow.
feelings. Yeah. So,
Wow. Awesome.
so yeah.
Oh, so Bret, you're putting the screws to her a little bit.
Yes, I am.
Oh,
Yes, I
goodness.
am.
Oh, my. You're a brave man.
Yeah.
Where did you go to school, Amanda?
I
You got your MHA as well?
yeah, I did mine at University of Southern California. So apparently you and I both picked football schools. Matt failed to mention that his was at Ohio State.
Was. Yeah,
Yes.
I am a Buckeye fan. It's been a good year. Also a tough. Anytime you get beat by Michigan, it's a hard year. But if you go on to win a national championship, it's still
That
a
helped.
pretty good year.
Yeah. I actually was not a football fan until I went to grad school because the place I went to undergrad lost. So it's hard to get behind that.
Oh,
At least your school had a football team.
This is true.
We just had the remnants. We had a stadium and no team.
oh my goodness. Where'd you go to school, Bret?
University of Texas at Arlington. So
Oh.
it's one of those minor UT system schools.
It's a
Got
geeky
it.
little school for
Cool.
like engineering people. No, they actually have a lot of good programs. Okay, so my other question is actually about your undergrad, Matt. Spanish and history. What in the world were you planning to do with that? And then how did you get off that track?
Yeah, man. Well, I was also pre-med. And so pre-med's
Oh.
not really a degree per se. It's
Yeah.
like more of a track of science classes and whatnot. And I made it all the way through my junior year doing pre-med plus a double major, which was like, real glutton for punishment. And ultimately I took a step back my junior year. I remember this. I had this opportunity to go on fall break with one of my best friends his father was the CEO of a large hospital in central Illinois. And I was just kind of talking to him. I was like, I don't know if I want to be a doctor. I don't know if the clinical pathway is for me, but I still love healthcare. It's an incredible industry where you have a chance to certainly do well, but ultimately I have a strong desire to do good in the world. And he said, it's a different path. Let me tell you about this thing that I do and, healthcare management, and on the administrative side of things, you can still be in healthcare, but you don't necessarily have to deliver care to patients as a provider. And I said, that sounds good. And so when I graduated, Amanda, as you probably can imagine, like not really a market for history and Spanish majors,
Right.
unless I don't know, you want to teach or something. So ended up going straight into grad school from there and learning about this wonderful industry we have in the United States of healthcare.
I'm glad you made the jump. Okay, Matt, before we dive into Junction Health, you mentioned that you guys are an FQHC or Federally Qualified Health Center. Can you explain what that is? And also, is that the same as a community health center, CHC?
Yeah, that's a great question. So we tend to use those terms interchangeably, either a federally qualified health center, and we call them FQHCs for short, or community health centers, or CHCs for short. And they're community-based providers that deliver healthcare services to underserved communities. There's certain key features of FQHCs that make them what they are. So in addition to serving whether it's urban or rural, kind of underserved communities where there might be access constraints, you'll see them do things like providing a sliding fee scale so that individuals that might not have the means or might not be insured when they're receiving services can kind of pay a little bit of money. They are also they're governed by a board that is made up of at least 51% members of the community, which is really pretty cool. And then one of the other things, and probably germane to this conversation, as we discuss, what we're doing with Junction Health and what our core pillars and mission is that they do receive federal support. So they're eligible for grants under something called the Section 330 of Public Health Services Act. And that enables them to secure grant funding on top of some of the revenue they're generating from delivering services. And so you can imagine, right, as we look at the world today with shifting and changing administrations, right? We've all heard in the news, it was a week and a half ago or so, right? A freeze was placed on federal grants. And this is highly disruptive to the federally qualified health center network. And so where I'm going with that is, the mission of these organizations and their commitment to high quality clinical care is so inspiring and amazing, but the economic model is incredibly challenging. And when you look at the scale and breadth of FQHCs in the United States, it's pretty staggering to see what disruption in care might transpire if there are holds or freezes placed on grant funding that minimize their ability to deliver services, right? So there's 1,400 health centers across the United States of America. Right? Of those 1,400 health centers, each of them have multiple different access points and care sites. There's more than 15,000 of those. That's a lot. That's more than there are McDonald's in the United States of America, right?
Probably a good thing.
It's a massive, it is. It's counterbalancing some of the effects of fast food, I suppose. But they deliver a wide variety of services to over 32 million Americans. Right? It's a primary care, behavioral health, dental care, substance misuse. They're expanding into things like HIV and AIDS and hepatitis C. And when you just think about the fact that between almost 1 in 10 Americans gets their health care from a federally qualified health center, great clinical care, challenging economic model. This is where Junction Health has kind of come in and said, okay, how can we support these wonderful community assets and resources and ensure that they're able to deliver optimal care to their communities and continue to reinvest in those communities' health and well-being. Let me pause there, Amanda, to answer your question about FQHCs.
I think you did answer her question. I have a secondary question because I was first introduced to the federally qualified health centers through like the 340B pharmacy program. So the high dollar drugs pass through community at, extremely affordable to low to no cost. And of course I was exposed to it as a marketing ploy to find for employers how to source stuff cheaper, which was not the intent of that program. But my question is, do all federally qualified health centers have that 340B pharmacy program, or is that just some do, some don't?
Yeah. Oh, great question, Bret. So all of them have they're eligible for 340B. Some of them leverage that asset and that eligibility in a different way. And so, but quite often, I mean, just going back to your question about this concept of 340B and how does it work? How are they utilizing it? Oftentimes that 340B asset that they have is one of the driving factors for them either being profitable and being able to reinvest in their communities or not. And so I think the question, and it's a highly charged topic of conversation, and understandably so. And the 340B program has been around for a long time, right? So it was spun up in 1992, so it's over 30 years old. Generally speaking, it's bipartisan, especially folks that understand the program and look at organizations like federally qualified health centers that are leveraging this asset appropriately to really stretch scarce federal resources and also improve access to medications for underserved communities that otherwise might go without. Mm-hmm. If you look at the debate around 340B, federally qualified health centers are generally looked at as the good actors in this game, mm-hmm. and there are other entities, just candidly, that it's questionable as to whether there's
why does
some tomfoolery going on.
Yeah, why is there a 340B program running out of a very rich hospital at times? Yeah, and that can be a question, but we won't touch on that. So my follow-up is, does that play into infusion drugs, and is that part of where Junction came in, or am I just taking a stab in the dark and making connections not there?
Oh, absolutely. Absolutely. So, yeah, I'll give you some of the background. I mentioned Ben Wiederholt and Vinny Polito, my partners for them. I mean, all three of us came together. I mean, when I was in graduate school, I got bit by the safety net or essential community provider bug when I worked with a hospital in Chicago's west side called Sinai, and it's an incredible organization with unbelievably awesome people. But it was striking to me where I would show up to work every day, and folks just were set up for failure, essentially, right? Understaffed, under-resourced. It's just a challenging economic environment. And so I've spent a lot of my career thinking about that experience and reflecting on, like, boy, it strikes me that we can do better for these organizations and the patients they're working with. Now, Ben Wiederholt he was the CEO of one of the state of Colorado's largest federally qualified health centers for a number of years, and then he transitioned to be the interim CEO of organization called the Community Health Provider Alliance, which is a network it's an accountable care organization network made up of most of the FQHCs here in the state of Colorado. And then Vinny Polito his background is he's a clinical pharmacist by training, but Vinny would never say this, and he might kill me if he knows I say it, but like, I don't think there's more than 8 to 9 people in the country that are more knowledgeable about 340B than Vinny. And the reason he got knowledgeable is because he worked for a rural kind of critical access type hospital, and they needed to get creative about leveraging their pharmacy to stay open and serve the needs of the community. And so he kind of had firsthand knowledge of that. So the Junction Health concept, the dream of like Junction Health and what can we do to help health centers, how can we immediately make an impact on improving access to these life promoting medications for underserved communities and patients that are struggling with chronic diseases, autoimmune disorders, et cetera, while also helping drive an incremental revenue stream into the organization that minimizes risk, by the way, for them, so that if there's a federal freeze in grant funding, they can kind of fall back on this thing. Like, all of our backgrounds and experiences pointed us in the direction of infusion being a wonderful service that we can help FQHCs with, and it's going to benefit those communities, and also it's going to be driving an incremental revenue stream into the organization. So, does that make sense, Brett? Did I answer your question?
Yeah, no, absolutely. And then I suppose, was the infusion service, was that the problem you wanted to solve first with Junction? Or was there just like, what can you do for a federal qualified health center? And then that landed as the most common.
Oh man, that is a great question. You're going to take me back to like 2+ years ago when we were actually sitting down and writing the business plan for Junction. So we sat down and we said, we know we want to work with federally qualified health centers because we love this care delivery model. And what are some of the issues? We just wrote it on a whiteboard. What are the problems, right, that need to be solved for? Access constraints, right, and funding and economics. Those are the two things that kind of popped up on our list. And then we said access. Well, okay, what's the issue with access? Is it primary care? No, they already have that, right? And we said, okay, well, what are the things that patients may struggle with? Well, specialty care access in particular is huge. You've got these FQHCs that are caring for the primary care needs of patients, but if somebody has rheumatoid arthritis or Crohn's disease or multiple sclerosis or whatever it is, right, generally they get referred out to a specialist in the community. And probably no surprise to y'all, but it's more challenging for somebody that may be enrolled in a Medicaid program or a county-based healthcare program to get access to these specialty services. And so we said, well, what if we focused on that? Right? Like, what if we looked at ways that we could essentially help bring a service to bear that fills a gap or a need for these communities that these FQHCs serve? And what does that look like? Do we just provide, like, do we create a provider group of specialists and, do that thing. And we said, I just don't think that that's really possible for us right now, but we could create interesting partnerships and relationships with community-based rheumatologists and gastroenterologists and neurologists. And, one of those core ancillary specialty services that these types of providers deliver is infusion. And we said, well, we could just be a pressure release valve for these providers that are looking at these patients that are enrolled in a Medicaid program. And I've yet to encounter, by the way, like a specialist provider that is not an incredible person that went into medicine for the right reason. But if you're looking at an infusion medication, maybe that infusion medication costs $5,000 each time it's infused. Well, if that provider is only being reimbursed $3,000 for a $5,000 drug, right out of the gate, it's really, really challenging for them to deliver that service, understandably so. It's not because they don't want to, it's economically not feasible. And so we said, what if we, through leveraging appropriately this 340B asset, we could make a little bit of a margin on that drug, and we could just raise our hand and say, hey, rheumatologist, neurologist, gastroenterologist, whatever specialty it is, please, by all means, if you have a patient that's enrolled in these certain types of payer programs, send them to us. We will gladly take them and care for their health and well-being, and then make sure that we have an integrated model and we're sitting back to you and communicating, et cetera, et cetera. So let me pause there.
Yeah. And so then, that answered a ton of that question. And I'm curious, does the infusion center, is it always your infusion centers? Are they embedded in those clinics, external, a mix of both?
Yeah. Well, okay, man, these are great questions. I love these. When we started looking at the F2 market, this is where my comment about there's 15,000 access points that these F2HCs have, right? But generally, when we talk to our F2HC clients and partners, we say, really, to begin with, we probably only need 1,500 to 2,000 square feet of clinic space. Do you all have that already? Is there a way to identify where we can be housed? And then that federally qualified health center, they own the asset. We are simply a management services organization. So we come in, we will help with the build out of the infusion center. We will manage the project from start to finish. And then once we open the doors, Junction Health effectively is managing that clinic. So we're doing everything from, processing referrals, doing prior authorizations. We've got staff that are actually delivering, nurse practitioners and nurses that are delivering the medications and doing a follow-up with these patients and whatnot. And so but at the end of the day, the F2HC still owns that asset. It's theirs to own, and they're just contracting with us as a management services organization. And because of the breadth of access points that they have, it's usually we've not really run into a lot of scenarios where an F2HC doesn't say like, yeah, we've got 1,500 square feet of space that we can allocate to this new service if it's going to benefit the community.
Yeah, I'm sure that they really want to bring that in-house, and I really appreciate that your model allows them to expand their services while potentially bringing in revenue, but most importantly, removing a huge barrier to their patients getting the continuity of care that they need from specialists. So absolutely incredible. In that vein, and I want to be careful how I say this because words matter and intentions matter, and I want to be really clear that I think any business making money is a good thing. You probably need to stay in business. And there is a lot of money being put into the infusion space right now. And there's new drugs coming out every day, and there's patients that need them. So in general, this is a very, very good thing. And there are a ton of companies doing really good work and really taking great care of humans in the space. That said, in all the years I've been doing this, you guys are the first client that ever said to me, we want to take care of people that are on Medicaid, and we're open to even caring for people that don't have the ability to pay. How unique are you guys in the infusion space, or is this something that is a pretty regular occurrence and I'm just not aware of it?
Yeah, and I hope I'm not sounding like I'm tooting our own horn as it relates to
Well, I
our
tooted it
curriculum
for
and
you.
you.
Done. It's been
Thank
tooted.
you. Appreciate that. Appreciate that. We haven't. We've seen a handful of FQHCs that are doing this on their own, which is fantastic. We've also seen a couple of other infusion management services organizations that have thought about getting into the market. It. I think the challenge is that there's a relatively complex structure that needs to be set up for infusion services to be attached to the federally qualified health center and maintaining compliance and fidelity, honestly, to the 340B focus, right, of stretching scarce federal resources and ensuring that underserved communities are getting access to these medications that they otherwise would not. And so I think some folks have tried to dip their toe in the water, but haven't quite gone all in the way that we have a federally qualified health center market.
Yeah, definitely. And I should mention that what you guys do is extremely complex. These are often very sick patients, and you're delivering really potentially dangerous drugs. And so this it's not just a simple pop in and visit you. I mean, there's a reason why infusion centers exist for this. But add to that the patient population that you're serving there and potentially other things that are going on in their lives. Is it reasonable to think it's even more challenging than a regular infusion center?
Yeah, that's a great question. I don't know what a regular infusion center's challenges are, so I don't want to say that our job's any harder or easier than theirs.
What if I
Um,
say with people that have more complicated social determinants of health? How about that?
Totally. And there are. I mean, it is. There are some unique challenges that we face, but we also look at it as what an amazing opportunity because like one of the things that I think is really beautiful about infusion, right, is that generally speaking, when you look at patients that are coming into a federally qualified health center for primary care, I mean, these organizations function like a lot of primary care offices, and that's the providers have a limited amount of time to see their patients and understand what the maladies are, or any underlying challenges related to social determinants of health.
Mhm.
With infusion, holy cow, what a blessing and a gift to have somebody, a captive audience, which is a patient in a chair for 30 minutes to 3 hours,
Yeah.
where, and also they're coming back on a very regular cadence. And so there's a lot of comfort and trust developed with that provider when you're coming in and you're saying, "Oh, hi, hi, Dr. Brummitt. My gosh, how are your kids doing? Is, Joey still in college?" And then you know them, and there's just wonderful rapport. And I think that trust development presents a real opportunity for us to identify other ways that we can help support these individuals, right? If they have challenges with transportation, if they've got housing uncertainty, if there's issues around food and nutrition, if they had a spouse or a caretaker that passed away, whatever it may be, it's a real gift for us to be able to peel the layers of that onion back and then go back to our FQHC partners, which, by the way, have incredible resources available to these patients and relationships with community-based organizations that we can plug them into. And so there are certainly unique challenges, but we look at it as, oh man, just wonderful opportunities as well to improve the health and well-being of these patients.
Yeah, definitely. Like, we'd like that 1,500 to 2,000 square feet next to your social worker's office, please.
Totally, totally. And that's the thing. These FQHC, like those social workers, those care navigators, are just awesome. They know exactly what to do for these patients. It's a really beautiful thing.
So when you've gone in, you've created that relationship, you're getting that team, like what are the things that the FQHCs tell you within the first few months of setup? Do you get a feedback loop of what's happening from their experience?
Generally, what we hear from the FQHC providers is, gosh, this is helpful for my patients, because whereas before they were trying to refer patients out to specialists, maybe they knew that this patient would benefit from a from a biologic infusion of sorts. And they'd refer this patient out, and then that patient would disappear into the ether, and they'd resurface 6 months later, and they'd be like, hey, did you see Dr. So-and-so? And what about this infusion? And the patients would be like, I didn't even get an appointment, the wait times are a year long, or I couldn't function. We hear all the time. I mean, all the time. I would say 80%, right? I need to look through our data, but like 80% of our patients generally will say, like, I looked around, I couldn't find anybody that would accept me because I have, Medicaid or, a county-based healthcare plan, et cetera.
Good luck.
Yeah. And
It's
so
terrible.
these providers, it's hard. It's really hard, Amanda, for these patients. And so I think the provider feedback has been, wow, what a great expansion of services by this organization to meet the unmet needs of the community. And then on the more administrative side, I think the organizations appreciate just the financial opportunity and the return on investment that comes with a well-managed infusion center that is, again, utilizing this 340B asset appropriately, but still able to generate some retained earnings for the organization.
Yeah, and I know you work mainly with the centers and that feedback. You did mention, some of the patient experience. Do you guys capture or hear feedback from the actual members or, patients that are getting the services?
Bret, it's awesome.
Okay.
It's awesome. We send out newsletters to our partners every quarter, and we try to incorporate at least one or two patient stories each time we do those newsletters. And I'm happy to share a couple here.
Yeah.
And this is common. Like this is what we hear. I mean, one patient that we had was an individual that had a GI condition, and from the time they were 16, they were prescribed an infusion medication to treat this GI condition. And now this individual's a little bit older, but for many years has depended on this medication to manage their GI condition. And then there was an issue with the patient's insurance, so they were kind of kicked off of
always
whatever
an insurance issue. Yeah, always an insurance issue. Yes, I'm with the guys to blame.
It is. It's tough, but the infusion provider, I mean, going back to what we were talking about before, the specialist and the infusion clinic that this patient was going to kind of said, hey, we can't just eat this, $5,000 a month drug. We can't see you anymore. And so they were just left in the lurch. And, this patient and their mother were just looking around, desperate, trying to find anyone that could continue that therapy that they'd been receiving for, probably over a decade, right? And help address their condition. And because of, our ability to procure drugs at a discount, working with a federally qualified health center and some of their resources that help individuals get enrolled into different health insurance plans, we were able to essentially talk to the patient, and they were said, hey, is there any way that we can get in, by this date? And we said, absolutely, we'll get you in, and we'll work with our SQ partner to get you enrolled in a new health insurance plan. And it really didn't disrupt care. Another one, I'll just end with this one. This one hit me in the feels, and I get choked up a little bit every time I tell it. But there's a young mother who had recently been diagnosed with MS, and we got a phone call from her, and she had a young baby at the time, and because of her condition, she said that I just want to hold my child. I can't hold my baby. And I've been prescribed this infusion medication. I've called around to 6, 7 different places. Nobody will take me. She's enrolled in Medicaid, and this was in, I think, early December. She said, like, can you just get me in before the end of the year? And we said, oh, are you kidding me? We'll get you in for the end of the week. Right. And that's our commitment, right? Just like a couple of stories related to access constraints, issues with getting, care that is beneficial for these individuals. And again, it's us leveraging an asset that's available through our partnerships with fairly qualified centers appropriately to bring these folks into our infusion center and deliver the medications that they need.
Yeah. And, the end of the week story, that to me, that's super powerful just because even with good health insurance, good payment models behind stuff, I have trouble getting people in what a normal person would consider a timely manner when they're going through a large critical health episode. The idea of a month and a 30 days is an eternity for someone going through something like that. I mean, especially, holding baby, not holding baby. That's like hour by hours a year.
Yeah, you're right, Bret. That's a really good point. And I think it's exacerbated if they don't have commercial insurance or a bag of cash sitting around to pay for it, which most people don't. So yeah, just really exemplifies the beauty of the work that Junction Health is doing. So let's change gears and talk a little bit more about you guys that built Junction Health. One thing I've noticed in all of our interactions, your entire team, but particularly you and Vinny and Ben, you just exude this kindness, collegiality, positivity. Are you guys just that way? And that's why the three of you became friends and colleagues? Or is this something where you sat down and wanted to create a culture where that's just how it is?
Yeah. Yeah, it's a good question. And I wish Ben and Vinny were here. You definitely got the junior varsity team as it relates to good humans. Because Ben and Vinny are genuinely two of the best. I've known Ben for well over a decade. Ben, is in addition to being an effective healthcare executive, is an incredible father, husband. I would say a pillar in the community, doing just great things. And I have all the respect in the world for him and Vinny too, right? Just Vinny did a stint. He started his career in nonprofit world, working with hospitals, health systems, et cetera, and then did a little detour into the for-profit space and said, this isn't really my cup of tea. I want to get closer to doing some good things. And I adore. I mean, Vinny's the godfather to my youngest son, right? So
Oh, wow.
we're a tight knit crew here, and I think all of us are really centered on these, those two pillars of Junction Health that I mentioned earlier, right? One is 100% committed to maintaining a focus on improving access to life-promoting medications for patients that otherwise struggle to get them in partnership with FQHCs, and then driving incremental revenue into these organizations that they can then reinvest into the health and well-being of communities that they serve. And we have this singular focus and mission that, we constantly are reminding each other about every day. And that's enabled us to, I think, recruit some really wonderful people, really wonderful members of the team that are culturally aligned, which then it just feeds on itself, right? Just you get some great people in the door who are much smarter than me, Ben, and Vinny. Kind of low bar. But it's been an incredible experience, and I can't think of doing it with anybody else, going through this journey other than the two of those guys and all other members of the team that we have on board here.
Yeah, that's really cool. And I love that it sets an example for the next wave of healthcare professionals, that you can do good in the world and still make a healthy living. You don't have to pick one or the other. You guys do both and make it look easy, at least from the outside.
Oh boy, man, we've pulled the wool over somebody's eyes. That's good.
I mean, she's gullible for a good story. No, I know it is one for sure. It's early on, in the process in the life of Junction. So what, if you can look forward, what do you think your biggest legacy from the investment you're doing will be through the Junction efforts?
Yeah, goodness. Yeah, I read through this question in the pre-call notes, and this is the one that I was struggling with the most, Bret, because I think that legacy is kind of a big word for us, and our hope, and I'm speaking on behalf of Ben and Vinny and obviously myself here, but we don't have a lot of ego, or enough ego to think about legacy. What we want to focus on is what's in front of us in terms of helping individuals, right? So those two stories that I mentioned, I mean, I could tell 10 more, right? And that are almost exactly like that or similar thread. And each individual that we touch that has, there's a positive impact on that individual's life makes all of this worth it. And having the opportunity to do that, not just, in Florida, but in Texas, South Carolina, Colorado, you name it, right? As we grow and scale is just such an incredible reward in and of itself, knowing that we're able to do something very special that has a material impact on somebody's life. I mean, I don't know if you've known somebody maybe that has like rheumatoid arthritis and maybe they've gotten a biologic infusion medication, and essentially like you are changing someone's life for the better. I mean, they've almost gone from, depending on the situation, right, struggling to get out the door in the morning and do basic, activities of daily living and be a contributing member to society, to living a relatively normal life. And that's something that we are just absolutely thrilled to be able to do, like a service that we're able to offer to folks that otherwise might struggle to get access to those medications.
I think that's a fantastic answer towards legacy. And I do know that's a super nebulous term and grandiose and not meant in an ego way, just, what's that biggest impact? And so I think those individual touch points is a fantastic wrap to that.
I just realized as you were saying that, total coincidence, our next show is Lone Star Circle of Care, the big FQHC here in Austin.
Yeah, we know them. Yeah. That's great. Yeah, we talk to them a lot. They're doing some cool stuff. We have a ton of respect for that team.
Cool. Nice. It's good to hear. So what is next for Junction Health? Now that we know it's not building a super fancy legacy that you can all brag about later.
Yeah. Yeah. Well, it's, going back to a little bit of what we discussed earlier. I mean, what's next for Junction Health? It's always tough to stay focused early on in an endeavor. I mean, we're still a relatively young company, only having been 20, couple years old. And so keeping our eye on the ball as it relates to building and operating infusion centers that have a positive impact on communities and also generate retained earnings is very much what we are really, really focused on. And we're trying to not to get distracted by the shiny objects. But there are so many opportunities that we see every single day, and we say, oh my goodness, wouldn't it be cool if we could do this thing? Such as, we work with a health center in Florida that has a special relationship with a large school district. And that large school district is saying, we're spending, our healthcare costs are going up, pretty significantly outpacing inflation. It's minimizing our ability to provide wage increases to our employees. The teachers union is frustrated, understandably. Can you, as a healthcare partner, work with us to identify ways that we can kind of flatten out that cost curve for healthcare premium increases for employees? And so we're working with this organization and to support some direct contracting discussions and how do you maintain access to primary care services that are affordable, and also potentially looking at some of the drug costs associated with that employer. It's kind of the usual suspects, right? GLP-1s are kind of the talk of the town right now with employers, but there's a lot of ways that we can do that, and so that's given credence to us working a little bit more in the direct contracting space. But it's the sky's the limit, right? So as health centers, one of the things that I love most about health centers is their willingness to be innovative and solve problems on their own with, if they need to. Like, if you look back 20, 30 years ago, there weren't a lot of health centers doing stuff, offering substance use treatments. There weren't a lot of health centers doing hepatitis C care. They're like, these organizations are evolving entities, and so they're constantly looking at what are the needs of my communities that I'm serving, and do I build this on my own, or do I partner with an organization like Junction Health? And so that's where we're looking at, through the windshield, okay, what are those other incremental services that, may benefit health centers and their communities that we can bring into the fold on top of infusion services and direct contracting with employers or whatever it may be. Probably a little bit nebulous response for you, Amanda, but I hope it kind of gives you some thinking, or some of our thinking about where we want to go next.
Yeah, that's exciting.
Yeah. And I'm curious, I think you may have answered my question, but are there specific organizations that you're looking at that get you excited about that? Or when you're just drawing inspiration, like, are there other people we can go look up and see what they're doing? So we'd like, this is what Matt's talking about.
Yeah. Oh my gosh. I was thinking about this earlier. I mean, we have been so focused on, engaging with various health centers that are really interested in either, and not, candidly, like, not all health centers are in the same spot. Some of them are treading water, and they just want to, keep doing what they're doing so that they can continue to keep their doors open. Other health centers that we talk to are just, I mean, you mentioned Lone Star, like, I can't wait to hear the podcast with them because they just do such cool things. So organizations like that, like our client, Tampa Family Health Centers in Florida, largest health center network in Florida. We just signed another client on. Like, these are the types of organizations that we're really paying attention to because they have a strong desire and ability, candidly. It's not to say that other health centers don't have a desire, but they have the ability to think critically about investing in these different care delivery models and services. But one of the things that I also think a lot about as it relates to, like, where do we go next is really, like, focusing on research and demonstrating the efficacy of what we're doing, and in terms of improving the well-being of these communities, and doing so in a cost-effective way, doing so in a responsible way, and also in, like, driving that badly needed revenue into these organizations. So research is a huge area of focus for us over the next 6 to 12 months as well.
I'm so glad you said that. When you were talking about having that patient in the chair for 30 minutes to 3 hours and the education that you were doing and all of that, I didn't want to put you on the spot in that moment, but I was thinking, I hope you're collecting data on all of that, because that would be easy to duplicate in other settings.
Totally agree. Yeah, I was, as you know, just down in Florida this week, and had the chance to sit down with our clinical lead in Tampa. And we were having this exact conversation. Goodness, how do we take advantage of a captive audience and try to understand how we can be more impactful holistically, addressing social determinants of health, and not just a direct clinical intervention that might be delivered through the infusion center. So really wonderful stuff to come.
Exciting. Well, Matt, thank you so much for your time today. And thank you that the three of you had the passion and the desire to go in and help a population of people that I don't see others racing to help, and that you saw a need and said, we can meet this. And in that vein, you've done so much and are doing a lot. What can the Generous Impact listeners do to support your work?
Yeah, if anybody hears of an organization in their communities, an FQHC that has a need, or if they hear of patients with significant access constraints for things like infusion services or specialty care, boy, we would love to hear the story and understand ways that we might be able to help support them, their communities, or any FQHCs that they may know.
Fabulous. Well, thank you so much. We really appreciate you carving out time to be on here today, and just for all the good work you guys are doing.
Thank you. Really appreciate it. Bret, so nice to meet you. Amanda, always wonderful chatting with you. It's a privilege being on the show. Really appreciate the opportunity.
Okay, are you feeling inspired to go start a company to do good in the world? The Junction Health origin story is incredible, and it's so cool to hear how they are positively affecting the health of their patients. They are truly improving the communities they serve. If you want to learn more, find them at junction-health.com.